My name's Dale. I get to be the final show here for you today. I'm a clinical social worker and I'm a behavioral health consultant, so I work out of the family practice clinic and do individual consultations, as well as I do some of these briefings such as stress management and other things as well. So what I'm going to do is spend about the next 20-25 minutes kind of give an overview of stress management strategies. What is stress? How do we manage it? What does it look like? Now, in terms of stress, many people have probably heard stress before. So how many people can identify with saying, I feel stressed at times? Okay. And what kinds of things do people get stressed about? Kids can be stressful. What else is stressful?
Life.
Life in general. Okay. What else? Work can be stressful.
Technical difficulties.
When things don't work as what we wish that they would work, that can be stressful. Time. There's a lot of different things that can be stressful. And even in terms of why some of you may be here as well, when we kind of look at if there's concerns about your blood pressure, if there's concerns about your cholesterol level, health things also can kind of contribute to adding to stress. But the opposite is also true, that when we're feeling stressed, that can also add to these health problems too, which is kind of why I'm here to help you kind of look through some of those things. So, things that are stressful. Change. How many people have changes going on in their lives? And especially with military families, military members, think about the number of changes in addition to kind of typical or normal people's lives. People are moving sometimes every couple years. Sometimes people are gone for weeks, months, or years at a time and coming back in family. So there's a lot of change that's unique to the military, but just change in general. Other things that may be stressful: relationship stuff, finances, work stuff. So many of these we've already covered. The basic aspects of military life: basic training, new job, new living environments, new jobs, etc., etc. Current events can be stressful. Doesn't take too much to listen to the news at night, and oftentimes we can get things that kind of get us worked up, whether it's oil spills, whether it's natural disasters, whether it's the financial statuses, illnesses or losses. And some people may, as adults, or have kids that are in school, so school can be stressful as well. So what is stress? Well, stress is a physical, it's a behavioral, and it's mental responses to demands or challenges kind of in our life. Or from a physics perspective, it's it's an applied force on a system that causes a strain. Is stress always bad? No, why not?
You can have good stresses.
Absolutely. Some stress at a level helps us to get things done. If I didn't have a little stress about getting here to do this, I might not have left 5 or 10 minutes earlier. If I don't have a little stress to do my taxes or a little bit of stress to perform well at work, then I may not do as well. What we're looking for here is to, kind of avoid kind of the negative type of aspects of stress, which is what we're going to refer to as distress. Distress is when that stress level gets to a point that it starts to interfere with our ability to function in different areas of our life, whether it's work, home, relationships, health, sleep, all those kinds of things. But that's when we're looking at this is now turned into distress. And things that can be distressing. Sometimes it's that kind of cumulative effect where we do pretty well on short-term kinds of things when they're quick in and quick out. But those things that go on for months or weeks at a time, sometimes that takes a toll on us. It's kind of like that wear and tear on a vehicle. A lot of starting and stopping, things start to break down. And so again, we see that sometimes military family members, we see that in terms of as lives get busier and we're trying to balance multiple things. And you kind of heard some of that even in some of your presenters earlier about people have busy lives. So how do we kind of manage so that that doesn't kind of take over? Well, first, we need to kind of go, how do I know when I'm feeling stressed? Because our body oftentimes, or our behavior or other people may be giving us feedback, hey, you're stressed. How do you know when you're stressed? Anybody? Sleep may be affected when you're stressed. Okay? What else is a sign that you may be stressed?
Irritable.
Sometimes people get a little bit irritable, a little bit short, a little bit cranky. Okay? What else? It might be a sign.
Hair loss.
Hair loss, yeah, absolutely. Other things. Yeah, diet changes, changes in our ability to enjoy things. So there's a number of different things. Or even like when we're looking or listening to our body. What about when we're stressed? What happens to our heart rate if we're overly stressed? It can change, it goes up, which also, guess what? Blood pressure. When we are stressed, our blood pressure goes up. Now, many of you probably experienced a little of that when you get your blood pressure taken. And somebody says, hey, we're concerned about your blood pressure. Guess what? They just probably elevated your blood pressure a few more points, right? How many people that go for those regular checkups on that sometimes, you know, in the physician's offices, we go, okay, we're going to take it, and then we're going to come back in about 10 minutes, we're going to take it again. Because a lot of times that workup of getting into the appointment, getting it checked, that anticipation, all that stuff can elevate your blood pressure, and sometimes it's going to give you a false reading, or at least it's a response to stress. So some of the things we're going to try to help you with today here is that you do have a lot more control than what you may think about being able to lower your respirations, lower your heart rate, lower your blood pressure, and overall, you heard comments about trying to improve your lifestyle, feel better, function better in different areas of your life. So that's what we're looking for. So we're going to listen when we're talking about stress to our body. What's the body telling us? The headaches, the neck aches, the aches and the pains, those are signs of stress too. Those emotional things, that irritability, the lack of interest, the feeling down, the feeling worn out, those could be signs of stress. What you're saying to yourself. Think about that. If you're saying, boy, I never have enough time to do anything, or I can't do anything right, or everybody's always bugging me, or these darn kids will never listen. Some of the things that we say to ourselves absolutely can spike up our stress. Sometimes we get into kind of that toxic kind of language or words, those always, those nevers, those horribles, those terribles. And again, that can elevate our peace. It doesn't mean it's not challenging, or it doesn't mean for right now. And again, sometimes we pay attention to what we're telling ourselves, so that's very important. And our goal here is to manage stress, not to take it away. We can't take away your stress, can we? But hopefully we're going to give you some tools to be able to take care of your stress. So when I talk about stress responses, I kind of like to use, you know, the examples that our body doesn't necessarily separate what's real or what's vividly imagined. How many people have had a dream before? Okay. Now dreams, whether they're good or bad, can feel very, very real. If I'm having a dream about being chased or falling or something, I may wake up, my heart may be racing, I may be doing this, I may feel scared. It's not really happening. But because I was thinking about it, my body acts as if. Now again, if I'm thinking about this is terrible or this is stressful or this is that, then yes, my body is going to act as if. But the other part of it is if I'm thinking more reassuring, more calming thoughts, if I've got this, I can calm down, I'm okay, I can also lower some of those reactions and those responses. The fight or flight response. How many people have heard about that? What's the fight or flight response?
Stand and face the problem and run away from it.
Yeah, it's kind of a natural human survival instinct that we all have. And it's a very physiologic piece that if I perceive, if I interpret something as danger, danger, you know, that adrenaline kicks in. It gets the heart rate changing, it gets the blood pressure changing, it gets my senses much more alert. Now sometimes that works for me. If I've got a child over here under a car and 2 or 3 people are running over and they're lifting up cars, sometimes that works for us to do things that normally we may not be able to do. At the same time, if I'm activating or over-interpreting something as somebody looked at me the wrong way, oh my God, they're after me and things are terrible and things are, sometimes we over-activate that, or if we're waiting in line trying to get on base, we start going, I'm going to be late and come on, move, and keep pushing up a little bit further, and why don't they have more people checking it? Again, I can be inadvertently activating some of that fight or flight response, which again is going to elevate all those type of things. So we're going to work on some strategies to kind of initiate what we call the relaxation response, which is kind of the opposite of that, to settle your system down. Managing stress through, you got a lot of this here with the aerobic type of exercise. Now you heard all the health benefits, you know, the heart health, the blood pressure, all those things by getting the heart rate up and rolling. But also the psychological, the emotional benefits of Regular exercise, again, I support that piece of that 40 to 60 minutes or that 30 to 40 or whatever you can do. Something is better than nothing. So if you don't have time to do 40 minutes, 30 minutes is better than 15 minutes, and 15 minutes is better than 0 minutes. But doing something, getting that heart rate elevated, maintaining that elevated heart rate, we know is associated with stress reduction, mood elevation, energy improvement, sleep improvement, cognitive and memory functioning. How many people at times are worried about, am I starting to lose my memory or my cognitive functioning? I'm not as sharp as what I used to be. Now, some of us, as we're getting older, that does become a concern. Well, guess what? There's more and more research that is now coming out that the #1 best thing you can do to keep your mind sharp and memory sharp is regular exercise. There was recently a study that was done that women walking 13 minutes a day, that was the #1 best thing over any type of supplements, over any type of mind or crossword or memory type of strategies, and that walking 13 minutes a day was the #1 best thing to keep people sharp. So imagine what you're doing if you're doing more than that by doing cardio or weights or resistance or whatever, and you're doing 30, 40 minutes of that on a regular basis. So again, we know that aerobic stuff can and does help. We also know that it's important to do things that you enjoy. So even though you may not get from the golf or from the bowling some of that cardiovascular piece, it's still important from a stress perspective to be able to say, hey, I got to do, and it's important to do things that I enjoy. Because when we go back to kind of that fight or flight response, or kind of a balloon analogy is, we're very elastic where we can kind of take in lots of things throughout our day. I've got the kids coming, I've got work, the traffic, the weather, and a lot of those things kind of expand. But if I don't have a regular outlet of kind of de-stressing or getting rid of some of those stressors, what happens? Kaboom. And kaboom may be sleep problems, kaboom may be health problems, kaboom may be saying or doing something that you regret. But at the same time, if I've got a regular outlet to kind of let out some of that air, like in the balloon, like exercising, like doing enjoyable activities, like taking breaks, like eating right, like relaxation strategies, that I can do this all day long as I constantly got these things, which I may not be able to control, that are stressors, but if I got these tools, these stress reduction strategies that I'm doing, I'm not going to get overloaded. Meditation, yoga, and prayer. Those are kind of those calming, kind of centering type of activities. There's lots of resources that are out there, but again, we have lots of research that shows that people that focus and are able to practice and train their mind and body in certain things, that can also help with blood pressure, that can help with heart health, that can help with overall well-being, and keep us from being as stressed. Good nutrition, you had a fair amount of conversation about that as well. What we eat affects how we experience stress or de-stressing. Social support, social activities, people we can talk to, activities that we can do. Managing stress through proper breathing. Now, each of you are still alive because you're still breathing, so this isn't a matter of saying that you aren't breathing. At the same time, how we breathe also can affect our blood pressure. It can affect our level of stress or how we experience stress. So, when we work on relaxation breathing, I teach people diaphragmatic breathing or belly breathing. That diaphragm is the muscle that separates our chest cavity from our stomach cavity. And most of the time when we are breathing, most adults, we chest breathe. And that does the job most of the time. But we all started off as little babies. If you ever look at a little baby or soon to look at a little baby, what goes up and down on babies? Their tummy does. We all started naturally breathing diaphragmatically. Now, when we're stressed or tense or that, oftentimes we either forget to breathe, we shallow breathe, or you hyperventilate. And when we kind of look at relaxation strategies, we want to do a slow and deliberate breathing, but also using that diaphragm. So this is when it is okay to stick out your gut. Many of us are walking around trying to keep those things in. But our principles of relaxation breathing is to take in a slow breath. But many times people forget about it's hard to take in a deep breath if your lungs aren't already empty. So when people are panicky or anxious or they're hyperventilating, a lot of times the first thing that we need to tell people to do is the opposite of what their impulse is, because they're trying to suck in the air. I say, you got to blow out first. You got to empty your lungs. You got to kind of tell your body to relax. So we always start relaxation breathing with exhaling, lowering the shoulders, open the jaws, empty your lungs. Unless your nose is clogged up, we're going to ask you to breathe in through your nose because it helps the oxygen to get to your brain and through your system a little bit quicker. And 3, 4, 5 seconds, as you're breathing in, I want you to push out your stomach, because when you push out your stomach, it pushes down the diaphragm, which allows your lungs to fuller inflate. So people that are singers, people that are wind instrument folks, people that are athletes, people that have heard Dale talk before, they know about that this helps with your lung capacity. It helps you actually when you're working out, so you aren't getting those side aches, so that you aren't getting as winded and you have more endurance to go. But it also helps to initiate that relaxation response of slowing down the system. So we're going to breathe in 3, 4, 5 seconds, pushing out the stomach. You're going to hold it for a couple seconds, and then we're going to slowly exhale out through your mouth, 3, 4, 5 seconds, emptying the stomach, letting the stomach go back in, pausing a couple seconds. So it becomes a very rhythmic piece. Now at first, people are kind of going, now what am I supposed to do here? It does take some practice. And what I'd like to do is I'd like to have each of you practice this with me, just so we kind of get a feel. I want you to put one hand on your chest and one on your stomach. And our goal is going to be that we're going to move the stomach as we're breathing more than we're moving the chest. So what do we start with? We start with the exhale. So I want everybody to kind of exhale out and just let your body kind of go limp. And then through your nose, take in a nice slow breath. And get that stomach pushed out, and then hold it for a couple seconds. And then I want you to slowly let it just kind of come out of your mouth and exhale all the way out. Let the stomach go back in, let the shoulders go down, and pause a couple seconds. And take in another slow breath. And hold. And slowly exhale. And as you do that, the goal is the more you do this, you're going to get at it better. And sometimes it kind of goes, okay, what am I doing here? Am I doing it right? But like anything, after you've practiced this day after day for about 30 or so days, it's going to become a very automatic type of thing that you're going to do. Now again, you can do this when you're feeling stressed. You can do this before you get your blood pressure checked. You can do this before bedtime. But the other part of how we want to teach people with some of the relaxation stuff is I want to teach people kind of what we call cue-controlled or relaxation strategies. And really this is very similar to smoking behavior. Any smokers or reformed smokers in the classroom? Okay, smokers, why do you oftentimes hit that cigarette? I feel stressed. So when you have a cigarette, what's your association after you've smoked the cigarette? Do you feel less stressed? Sometimes not. But a lot of the behavior of smoking, I'm not endorsing putting the chemicals in your body. That's really not very good, we know, health-wise. But the smoking behaviors, think about many smokers. If you're a pack-a-day smoker, you're doing it about 20 times a day. What are people doing? Most people don't get to smoke in their office, right? Or at their work. So oftentimes you're taking a break. You're getting away from a situation. You're taking a break. When you're smoking, you're taking a deep breath. You're holding it. You're exhaling it out. There's a social component. There's a distraction component. So you've got all those things, and you're doing it every day, multiple times a day. So what I'm going to propose is, can we do the non-smoking breaks? Just as Marcy earlier said, when other folks are in the work areas of that taking their breaks, take your wellness break. You know, walk around, stretch, do whatever. Well, guess what? You can take the breathing or the relaxation breaks as well. Now, for some people, we kind of assign the cues, and I'll give you some handouts that talk a little bit more about each of these, because this is just a short overview of many things that we could go in much more in depth on. But with the cue control, you can do a symptom cue where the first sign that my neck's getting tight, or that I feel my heart fluttering, or I feel like I'm getting irritable, that may be your reminder to say, hey, remember to breathe. Or it may be those external cues, reoccurring things every hour on the hour. Every time the person next to you goes out to smoke a cigarette, that's your cue to do that. Every time you get in your car, every time you check your email, whatever it may be. Or with little ones, every time after you've changed the diaper and you're cuddling. So there's lots of those things that you can just incorporate it in. Most of us don't get the luxury to say, pause everybody, I need to de-stress, don't talk to me, leave me alone. How many people get to do that? So really what we're looking at is we're looking at a pause reset. Guess what? I can do this while I'm walking to my next appointment. I can do this in between my appointments. I can do this while I'm listening to a question or something that somebody's asking me. I do it when I check my email. I do it when I'm waiting for something to print because those darn things don't print as quick as what I want them to print. So instead of shaking and saying, hurry, I may take a couple breaths. So I probably do it 50 or 60 times a day without even thinking about it because it's an automatic thing. And I'm going to encourage each of you to look at about 15 to 20 times a day at least. Don't take my word for it. Do it, practice it. We know that that's one of the best things that helps with sleep improvement. It helps with pain management issues if people have any of that. And it helps with hypertension and stress issues as well. That people that do this and do it regularly are going to find that you're going to get the benefits along with all these other things that you've been learning here today. So, the other part here is sleep. Sleep affects a whole lot of things as well. Sleep affects our stress level. Stress sometimes affects sleep. I've got a lot of information on a handout about kind of good sleep hygiene and good sleep rules and guidelines. But in general, the key is are we getting enough sleep? Are we setting aside enough time? Are we doing reasonable things like not watching TV or working on our computers while in bed? Because many times people are sending mixed messages to their body. They're sitting in bed, they're doing these things saying, stay awake, nope, go to sleep. So anybody that has trouble falling asleep, sometimes they're saying it's a distraction, but we say, don't do that in the bed. Do it in another room. Do it outside of that. How many people wake up during the nighttime and find that they're kind of in and out of sleep? Sometimes. How many people are looking at their clock, checking the countdown, saying, darn it, how much longer or why am I still awake? So one of the things that we recommend on that is turn that clock. Have your alarm clock set. Have the set get up time. Have the set bedtime. For most adults, don't take those naps during the daytime. And again, turn that clock, set the part, and have the set time. So again, there's a lot of things that we talk about. Watch your caffeine, watch your alcohol, watch the nicotine, all those things at least a couple hours before the bedtime. Doing the stress management stuff also helps. So again, there's a lot of things that we can do. There's a lot of other strategies for sleep improvement if people have some of that. How do you avoid getting frazzled? Again, know your physical, emotional, and behavioral signs of stress. Keep your eye on those negative thoughts. I've got a handout here on kind of, again, the thoughts and how that affects us as well. Use your stress management tools, the exercise, eating healthy, hobbies, relaxation, social support, and positive reinforcement. So that is kind of in a nutshell some of the stress management stuff. Again, you can get a hold of me. I do individual consults. If anybody wants more information, you can go through your primary care. I do 20, 30-minute sit-downs, work an individual plan if people need that on a variety of health-related issues. The mental health clinic has supports and options for stress management in that. Health and Wellness Center, of course, you're aware of that as well. So any questions or comments, I'll be around for a while if people need to get going because I know we're clicking out on your time.